More circulation, the body's going to heat up, kind of like how you would run a car with low oil. Heat, friction, cellular damage. So here's the image of the cerebral. Now, it may look really bad, but it's basically telling you, check your inflammation in the circulation. So this is the cerebral. We're going to get a better shot of it. So all these black spots, this is your infrastructure. Your infrastructure, the infrastructure you would see as your arteries, your veins, your lymphatic system, roads traveling in and out of the cells. Here we are in the cerebral brain. And all of these black spots, this should be yellow.
You can take that off.
Oh, you can, oh, thank you. And let me see if I got the lipstick on. Okay. So what we're seeing is actually the impairment of blood flow. Now this could be related to not getting enough oxygen, which would cause free radical activity.
I do have, what do you call it?
GERD,
Hiatal
hernia. Okay, we're gonna go because I see some issues down in your gut as well. So the first thing we do is take a look at the head, because the head always rules. That's like your hard drive. Okay. So we know inside of these areas here, boy, these are little dams that are set up. Little dams that actually impair blood flow. There again, we want all of this area to be yellow at least as much as possible. So that's one thing that we're going to look
So
at.
there's no yellow.
No yellow. We're going to help you get some yellow. Okay. All right. Now let's pull up another one. Here's the capillaries. Now here's your infrastructure right here. Here's the capillaries. Now, capillaries, what do? They carry blood. But it's letting me know that you're getting a lot of vascular constriction. You want to know what is the origin. Why are you getting that? Okay? And that's what you're here for. You can't fight what you can't see. So your body is feeding us information. So you can't be afraid of yourself, you know. But this is what your body is saying about this is what's going on inside. Well, let's take a look, because a lot of times when people come in, they already know what their condition is. It's not like I'm really telling them anything different. What I'm going to do is I'm going to tell them how it links and how can you back your way out of the health conditions that you're experiencing. So here's one. Looking at there again, the infrastructure of your body is showing us that, okay, the infrastructure is inflamed, is causing vascular constriction. If you cause vascular constriction, you slow down blood flow, you slow down detoxification. Definitely you impair these functions. So we have capillaries, we have, let's pick up just some of the things that you have here. Oh, speaking of anxiety, the reason that you would be more predisposed to anxiety, because you don't have enough oxygen. See, the capillaries carry your red blood cells. The red blood cells do what? Carry oxygen, an iron molecule. They also carry toxins out of the body. So when I see anxiety, it's like someone suffocating you, because that's an arousal or hyper arousal, and that heightens you up into a state of anxiety. Now, when I use the Lyris taps into the subconscious mind and allows you to tap yourself down you learn how to self-regulate when that sensation comes, and a lot of times it's influenced by hormonal. I went through this when I was in my late 40s, and I couldn't even really go into Publix or Walmart to Kroger. I would start feeling really anxious, like the lights were too bright. I mean, my heart would start.
Like social anxiety.
Yes.
I didn't even, I'm like, okay, I only could stay here for a few
You
minutes. Guys.
got
I
it.
gotta go.
Exactly. I would be in and out.
Yeah, this feeling would come over me, and I'm like, what is that? Yeah.
Well, at that point, I think I was beginning into the perimenopause, and it heightened. I can recall driving.
My cycle ended at 47.
Okay, well, it's
I was just telling
linked in.
someone yesterday that there's a connection between
There
that
is
and my hormones.
Yes, there is a connection. I see that a lot with women, and it's usually right around the time that they're moving into menopause. All at once, they're like on go with anxiety. Then I catch some women, they've had it most of their life.
Well, I've had
But they
anxieties from earlier, but some of those other things
get intensified.
Yeah.
But this is the thing. Even when they've had them earlier with this population, they tend to have problems with their menstrual cycle anyway. So it's still something like they're irregular, they have fibroid tumors. There's something still there. They're just not in perimenopause, but they're having a hormonal imbalance. Okay? So definitely I'm gonna show you. You definitely can't rule it out because when we go up here, I just looked at it. It was the uterus. Where did it go? Because it links us back to the female hormones. In here somewhere, like I said, you got a lot of data. Here, follicular ovaries, that's hormonal. Let's just take a look at that real quick while we're in the neighborhood. There it is right there. Hyperestrogen.
So too much
Too much estrogen. Absolutely. And not only that, but it also points us back to the ovaries, which is going to get us right back to the osteoporosis and also the anxiety and the hypertension are all linked, especially for you. Mm-hmm. Okay, and let's go to the next one. So there's our connection, and this even more. You build up your reliability or the credibility of the scan by replication. If the computer keeps recalling a particular function, that's how reliable it is. Because that's like kind of hitting the lottery. You're not going to hit the lottery just over and over. But when the data is reliable, it keeps coming back. Female organs, or arteries are skeletal. So it repeats it in several different ways that the body is scanned. That shows us reliability. Here's our erythroblast. There's our erythrocytes. There's your oxygen right there. So you're not carrying enough oxygen. There's the nerves
sometimes
in
when
your
I
head.
do talk, and it's like,
Oh,
you
yeah,
gotta
you
talk all the time.
You got to kind of pull that
Yeah.
oxygen in. And then here's the poor blood flow that's coming off of the superior vena cava of the heart, which contributes to the high blood pressure. Okay? And then we tune up on gallbladder. And then but not too bad there. There is something going on maybe a tooth.
Yeah. Mhm.
Okay.
Yeah. After I've been having a toothache over here, I went to the dentist a couple of weeks ago, and over here I need to get another crown.
Mm-hmm.
And they're looking at this one as well.
Okay. There's the heart. There's contributes to the hypertension. Here it contributes to the hormonal. That's the hypothalamus. And then kidneys. We got to watch that because that's blood pressure too. Not breathing deep enough, but sometimes the hernia can contribute to that. Inflammation in the esophagus, upper large bronchial. Okay. Lumbar plexus. This is the beginning of nerves that are irritated, inflamed. That contributes to lower back problems or skeletal. Not just lower back. Cleaning your lymphatic system. Let me grab something real quick so I can let this young lady out. I'll be right back. Okay, darling, I'm gonna get you out. Okay, dear, I'm coming. Let me get her photo and I'll be right back.
Okay.
Okay, so you just get right here. There you go. You're good. I love you too, girl. You take it. Enjoy the rest of your week, okay? Okay, dear. All right. So this is your lymphatic system. And so we need a reboot there for certain. And then, like I said, heart, lungs, liver.
I know I had fatty liver a couple of years ago.
Really?
And the last scan was fine.
Okay. And something that's very common with lupus is kidney. Let's take a look at this one.
The kidneys okay?
No, they're weak.
Hmm?
They're weak. That seems to be common with lupus.
Yeah. My brother had
And-
lupus as well.
Okay, there it is. Hydronephrosis and idiopathic hypertension. And actually acute polynephritis. Now, the way that you look at this too in your labs, you look at your GFR, your creatinine, your BUN reading, they give you a heads up. But if you have blood pressure issues, this is going to be related, including the infrastructure, the constriction within the vascular system. So the way that we would treat this, let me give you an example. How we would go to biochemical, and here it is. We have angiostensin. Well, that's angiostensin for blood pressure. This is a natural cortisone. This is a blood histamine. So first we check this one. So the computer can literally give you a treatment through your headgear. Or you can have it custom made. They'll download a frequency. You'll have your own custom made formula made. It's customized for you. So the way that we test it, let's say, okay, we're curious, will this formula work for you? Because it's one of the formulas that your brain selected, but let's see. Take care, sweetie.
Take care, see you.
Okay, darling. Have a safe trip back.
Yes, ma'am.
Okay. So what we would do is come here and we're gonna test this formula before we give it to you. What is that? Oh, nice job. Okay. Then we can come here. And that's 27%. We can drain the kidney, push it, just push the energy, push the frequency. Now, the only thing about this, 27%, we would take it because we want something that's over 15%. But you don't have a second line yet. What the second line says is that when we send you this signal, you're going to be able to hold it. Right now, we kind of in and we kind of out. So that's why I tell a lot of my clients, don't wait so long to come back. Because, most clients don't, but I emphasize to try to keep your visits a little closer together. And the reason for that is initially we have to train your body. So if I send you a signal today and I don't send you another signal for 2 months, your body forgets what lane is in. We got to coach it. Stay in this lane. So every time you come in, we give a treatment, we're saying stay in this lane. We're retraining your body to do what it does best. But it takes a little time to do it. And when you start laying your second line, it's saying, okay, it's beginning to stick. So here, all these dark areas here, that means I give you that treatment. Might as well give you a dose of this. I'll give you that treatment. It's going to just open up your system. So you go to reprint, and actually it'll send you the frequency through your headgear, and it'll open up the cells where they can drain some. But see, I'm just giving you actually you already have a soft treatment. I'm just gonna hit you here in the kidneys for a minute. But then once you come back, we really take our time. I set up your protocol. It's usually 5 areas, and we're ready to reboot. That's where you're gonna get more into your customized formulas. Now, even on your supplements, you can bring those supplements in, you can test them. Do you need 1? Do you need 2? Do you have the right product?
Right.
You can also send your, depending on what program you're interested in, you can have your DNA analyzed for over 800 foods, including hormones, enzymes, biome, hormones. So that's a comprehensive report. It takes 14 days to get that report back. Okay? But make a long story short, these are the areas. Every area that is here that is red has a higher level than what is acceptable. A higher level of inflammation. And the ones that have the really darker red, like right there, the dark reds are going to have this 6, a black square. That's what we call a 6. These are 6s. That's lymphatic.
Lady,
Yes, darling.
Sierra's gonna use the restroom.
Go right ahead, darling. Just go right back.
So the black is not there.
No, that's the top. That's as high as the computer will grade you. So you see the different areas where we have the reds, deep red, we have black. So that's cleaning up your lymphatic system. But this is pretty standard what we would do with blood pressure, lupus, autoimmune. Autoimmune would be in the lymphatic system. And then we can even become more specific. We get into, let's see here, these cells here, red blood cells, bone marrow. There's your back. These are the joint areas. This is where the osteoporosis, let's see what it says. Let's see if it says osteoporosis. And you do have the polyarthritis. Because see, you know what? When I was first diagnosed,
So what's polyarthritis?
putting it as an infection that's in the bones. And you know, I thought that was just Eastern medicine talking about polyarthritis, but polyarthritis is listed in the American Arthritis Foundation on their website. Nobody talks about it. Okay, now, when I was first diagnosed, about maybe 2 years prior, I had the flu. And I mean, I had to really fight that flu up. I was popping supplements, but I recovered. But that one I remembered. I struggled. And a lymph node stayed swollen at my neck, right in the back. So I owned a reference laboratory. I was doing a lot of slides, so I had a little mark that was right here. And one of my board members, whose friend was Dr. Wiley, who was down the street from us, she said, "Why don't you go and see Dr. Wiley?" Well, that year, earlier that year, I went home for some, I think, family reunion, and my mother loved to do our hair. So she was like a beautician, but she wasn't. But she would always have all these cute tools in the basement. And she says, "Your hair is coming out." And she went and got a pencil. She drew it. She says, "You weren't losing your hair right here last year." And she drew it to look like an S. So, all right. So when I get to Dr. Wiley and I tell him, because this area was slow to heal, but by the time actually I got ready to see Dr. Wiley, it had healed, but I kept the appointment. I said that was God working. I went ahead, I kept the appointment. He charged me $150 for like 5 minutes. And then he was getting ready to walk out of the door, and I says, "Dr. Wiley, can you take a look at my scalp?" He said, "What's wrong with your scalp?" I said, "My mother said that my hair's falling out there. And this is where the lupus came in at." He comes in, I wanted to run out of there after he said, "No, we need to do a biopsy." So he did a biopsy, and when I went back, he came in with the pathologist, and he said, "You have the worst scarring lupus we've seen in our 30 years of practice." That's exactly what he said. And I thought, wow, the scarring. Then I remembered this lymph node was swelled. And I really believe that the lupus was a result of the body attacking itself because that virus was still in my system. And when I asked him, I've asked a couple of doctors about, even Dr. Thompson, who dealt with African American women with lupus, he said, "I don't know anything about that, but I don't think it's related to lupus, but whenever I would have those, initially I started having symptoms of lupus, and that lymph node would swell. And if I got the lymph node down, it would go away." So I started just cleansing, did my boards in Jamaica in 2000. And when I did the boards and got that new system, it told me that I had lupus, and that blew my mind because it only had my name and my date of birth. But it said I was deficient in alpha lipoic acid and DHEA. I left my office, I went and got those two products. But I also knew that I was already drawing blood in the reference laboratory. So I was familiar with blood chemistry, so things like ANA and CD complements. And I started telling my board member, I'm gonna start monitoring my A1, my ANA and my CD complements because they were a little elevated. They were even more elevated in the biopsy. So I started cleansing, using those two products. And the lesion was inside of my nose, and I was just thanking God for this because that lesion stayed there a long time. But so did that lymph node, and they were both on the same side. The lesion inside of the nose and the swollen lymph node. When I went into this deep cleansing and I applied the DHEA and the alpha lipoic acid, the lupus went to sleep. It really has been sleep. So I tell people it's a good roommate. We're not bothering one another, you know. And that's where I like to take my clients because discoid lupus takes you here. The bone structural issues. But you have polyarthritis, which also confirms that you have some type of infection on board. Now we don't want because see, they say, well, you know, with lupus the body is attacking itself. I say I don't think God created the body like that. I don't think the body would attack itself. It's attacking something that's in the body. Because that's an autoimmune response. But you can't tell me, for me, that my body is just attacking itself. It's after something, and my evidence was in my lymph nodes and that lesion inside of my nose. When that went away, then after I had that experience, it was like the Lord was sending me people with lupus. I mean, I was saying, okay, so I'm to apply what you taught me. And I'm going to apply this to the people who you're sending to me. And then my clients would say, oh, you know, I had clients with both Sjogren's and lupus. They could barely walk from like the front of my door in because they were so weak. And then all of us, they're doing well. They offer their medication. So I really believe that this is going to be one of our keys. And then when we look at the lymphatic system and also your white blood cells, that's going to further confirm. That's further going to confirm what we're seeing. Okay, so let's see. The last one, let's take a look. But we already did brain. Gut. Let's go there. Because everything we do, you got to work within the gut. There's ovaries. A lot of activity in the ovaries. Because see, you got the excess estrogen. And we don't want excess estrogen because we also have to protect our breasts. That hurts too. Breast cancer is nothing to take lightly. So here, thyroid, that's hormonal. There's the teeth. A little irritation in the stomach right there. But the liver, a lot of activity. So we know that the liver helps to detoxify microorganisms. And that's exactly where we want to go. We want to go to the main organs that deal with detoxification. I don't see anything right off right there. But that is kind of your history, dear, is that, wait, let me check this. We want to work on cleansing microorganisms, balancing your immune system. We don't want it to be hyper-stimulated. Okay, here's your first 5. 1, 2, 3, 4, 5. We have an overgrowth of lactobacillus. We have adenovirus. We have Klebsiella. We have mycoplasma, which actually, there's a video that I play a friend is from a doctor at the University of California. And he talks about mycoplasma hominis in lupus and all autoimmune disorders. So here we have active bacteria. And we want to clear that from your system. So this is where we get into the deep tissue detoxification. Okay. So we got a lot of work to do. Your lower back.
So what is the polyarthritis actually?
Polyarthritis is that there's an infection that's in the bone, and instead of treating it with steroids, which you can, but you also have to treat it with an antibacterial. So we talked about when we do the cleansing, we use things like micro-cleanse, colloidal silver, say wormwood, but wormwood is actually in parasite cleanse, candida cleanse. So there are formulas that would deal with the polyarthritis is to clear the body of excessive microorganisms. And see, when they die off, they also cause issues within the bloodstream, and they cause issues on the red blood cells. So we're talking about deep tissue cleansing, body rebooting, getting your vascular system retonified, and then measured. Because when you do treatments and diet, like if you had heard this testimony this morning, that was so rewarding. Because my client, that blood pressure, she said, I've lost weight. My blood pressure's down from 168 over, what she said, 97, 102. She said, I'm running like 113, 109. She said, I'm not even taking my medication because my blood pressure is so low. She said, but it's the energy that I have. And I'm saying, you know what? we reduce the body, we reduce the level of inflammation in her body. And then as a result of that, boy, I mean, her skin was glowing, just everything. That was beautiful. That was beautiful because she's doing, the lady who referred her was with her. And she said, I told her. She said, that's why I'm in another package. She started another program today. She says, because I know I got a lot of work to do. Well, you have a lot of work to do, but it's not overwhelming. It may look overwhelming, but it's basically 5 things that you're focusing on. Okay. And the first one is really the infrastructure. Because from the infrastructure, you get to the inflammation. Otherwise, inflammation would be number 1, but inflammation really isn't number 1, it's number 2. Okay. You gotta get to the blood to cool the body down, carry out the toxins so that you're not getting repeated injury. When you get a repeated injury, what happens? The inflammation comes in and tries to take care of the damaged tissues. So you would be you could stop now and say, okay, that's enough information for me, I know what to do. Or you can say, come in and treat me, and then reboot me, do the cleansing sessions, and then see where your numbers are at. So you get your lab reports too, so we can see, what's your CPK reading, if your SED rate, what's your CD complements. Those give you a benchmark to say, okay, can I begin to lower my intake? And what would the rheumatologist say? Because oftentimes, my clients go to their doctor and they're like taking them off of the medicine. I said, they took you off of the medicine? They say, yeah. Because my numbers, I'm telling them I'm feeling really good. And my numbers are going down, or they're going up, whichever way they need to go. And their primary doctor take them off their medicine. I don't take you off of medicine. But what I try to do is get you in a position where you will do it, but preferably with the aid of, your practitioner. So if you just did your scan today is $125. If you decided that you wanted to go into a package, they start at $175. $175 gives you 2 visits, so you come back and you have the reboot session, and then you have a cleansing session. The $199.99 gives you 4 services. Now, I believe that $199.99 has the TMN. I have to look because those programs just started in December. I want to say that the $199 gives you that TMN panel as well. But you could start. Did you get a chance to look at the welcome package?
I mean, just glance at it, but not.
Okay, well, in there, it has the breakdown of the programs. I think I can hold it up here. But it depends on what you would like to do.
So how do I get this information?
Oh, I'll copies. I've already put some data in for you.
Okay.
As a matter of fact, let's see what we had. Sometimes this is a little overwhelming, so I only give a little bit of information because a lot of times people really don't know how to interpret a report. But, it's a little different. Before, the FDA would not allow you to print out a report. This program you can, but it's a little technical, so people really don't know what they're looking at. But here's the way that your report would look.
Okay.
So it tells you the bacteria. So it's the things that I just kind of clipped from the scan. And this will go to you. And you just look at it and say, okay, you can read that. You say, okay, that's nephrons, it's kidney, urethra, here's bacteria. See, I must have clicked on nephron. Oh, yeah, I was showing you something. Okay, follicular ovaries. So let me put one other one in here that's going to be important. That's going to be the capillaries.
So, so we're just gonna do one thing at a time? I mean, how is?
Oh, no, the program, no, it's a process. We start you with the farmer's diet. You got 14 days. If you're gonna do a reboot program with me, you follow the protocol. The protocol is that we send you the welcome package. The welcome package sends you the farmer's diet and the 28-day vegan diet. Because we try to pull you off of meat for 14 days, letting you
I'm
resist
vegan
the rest.
anyway.
Okay, well, you're good. Well, then you follow the 14-day regimen. You come back, it tells you to call in 7 days so that you can make your next appointment. Because a lot of times I'll get really booked out and I don't want people to wait a month to have to come in. So what I tell them to do is in 7 days, go ahead and start booking, set your appointments in. Then you come back and it depends on what we're gonna be doing. We may be doing a reboot, we may be doing deep tissue cleanse. The $2.99 programs, those are Lyris. That means Lyris. The Lyris is where we cleanse from the subconscious mind. So you lay back, there's a little bit of the heart mass going on, but the computer things that come up, I'm not kidding, that could be the Holy Spirit, because some things that come up, I'm saying, does that really apply to you? And they say, yes. And I'm really blown away that we can, and this, we cry so much because they releasing stuff, they're releasing things. And, but now that's something they go back and tell, they start telling people about that experience, but those are in the Lyris. And as a health psychologist, that's where I kind of help you to tap into that area and download, because people have injuries to the soul. And they mimic in terms of manifestation of illness. So some things, like I had a client last week that said, sick old man. And I thought, sick old man. And she said, oh my God, I can't believe that. I said, well, what does that mean? She said, my dad. She said, my dad, he just died. She said, I've been with him for 3 months because he was returning here. So she's telling me the history. She said, well, the reason I hadn't been in, because my dad was really sick, and she said he was mean when she was little, she said it, and he was mean on his deathbed. She said, and I was the only one who was there to take care of him. It said, sick old man.
Wow.
And see what happened? After we got that out, I checked her blood pressure. Her blood pressure had come down like 20 points. I said, see, now your father has passed. Now you have to release him.
Yeah.
So anyway, those
what do
come
you
in there.
suggest? I mean, is this
Well, when I tell people, when you have diagnosis, you're not going to get through on 1 or 2 visits. You need a little more comprehensive program, but it depends on how far you want to go into the program itself. Well, I'm going to pull it up for you.